Hey everyone, it's Chris Sovey with HealthyConsumer.com. In the next 5 to 8 minutes, we're going to discuss 7 important questions you should ask a new healthcare provider before trusting them with your care. I think that everyone has unique health challenges that need to be addressed by the right healthcare practitioner. And for you, that might be very different than someone else. So I've come up with 7 questions that I think address very critical things that you should ask a new healthcare practitioner. So we're just going to start to go through those right now. So here are 7 questions for choosing the most appropriate practitioners for your time and money. So question number 1. Are their results or clinical findings reproducible with repeat testing? Now, this doesn't necessarily mean that every test that they order or everything that they do for you or to you has to be verified by a peer-reviewed, double-blinded study. In fact, there's going to be a lot of things in our lifetime that are just that. They're a practice and it's not going to be studied for various reasons, whether there's no interest in it to be studied monetarily or for other reasons. But there needs to be a level of accountability from the practitioner. So that is where you could start to see if you can even establish a level of trust with them. Question number 2. Are their diagnostics or treatment plans empirically verifiable? So can their treatment plan or their diagnostic test be measured in some way or form? If they can't, I think that raises a red flag. Question number 3. This one's a little more of a broad question, but important nonetheless. One thing that you should consider with a healthcare practitioner is, what is their reputation in the community? Now, you can get a lot of different perspectives from this, ask around, or it could be more on the internet with something like Yahoo or any other review site. So Health Grades, I know there's some other ones out there coming out all the time. So be sure to look at individual reviews of the doctors. And of course, all reviews might not be accurate. Sometimes people only go on there to complain about things. Sometimes the people that are satisfied with their care don't go on and review. So it's best to talk to someone directly who's had experiences with that practitioner, preferably several people if possible. When you're searching for a new provider, regardless of the purpose that they're going to fill or the role, one of the things you might want to check into is what sorts of continuing education or extended learning has the practitioner participated in. And that will give you a good gauge on where do their interests lie. How passionate are they about whatever type of care that they're involved in? Now, this doesn't necessarily mean that they have to participate in formal additional training, new certifications, or anything of that nature, depending on what their niche is. Because in fact, a lot of holistic and integrative health now is learned through independent study. But if it's a very specialized field, that might not be the case. So make sure to check their credentials. On a more personal level, another question you might ask yourself is, how well do they listen to you? When you walk in that door and you start talking to them, do you feel like a person, or do you feel like they're just trying to fit you into a mold or a diagnosis that they've already established on preconceived notions for whatever reason? So this is one of the most important things when you're choosing a new provider is, how well do they listen to you? How well do they listen to your story? So the next question is similar to question number 3, and that is, will they provide you with patient references? Now, in this current time, that is more of a sticky situation because of things like HIPAA. So your information, your health information is protected by HIPAA. And in some cases, however, that information can be released, so you could talk to an individual patient. So I encourage you, if you have the opportunity to talk to someone who's previously seen this provider, do so and ask them very specific questions like the ones we are right now. For the last question, if you're coming to a provider for a very specialized reason, I think a critical question to ask them is, what are their past results with the particular affliction that you're dealing with? So if you're suffering from a chronic disorder of any kind, make sure that you talk to them about it, and make sure that you ask them about their success, their knowledge, their failures, and be very upfront about it and see what kind of results they've had with other patients. So you could go back to question number 6 and see if you can find the specific patients who have had this particular diagnosis. And there's also the fact that if someone is very specialized in something, They may not look at the bigger picture. So I caution people about that as well. You want to make sure that in chronic disorders that you're looking at the bigger picture, because that is sorely missed in all forms of medicine. So those were 7 critical questions that you should ask a new healthcare provider before proceeding with any relationship with them. Thank you very much for listening today. Be sure to click below and subscribe to our YouTube channel. Visit our website at healthyconsumer.com for more information on how to choose the most appropriate healthcare provider. Be sure to subscribe to our mailing list for more helpful tips like this. Thank you very much and have a blessed day.